Good morning everyone, I'm Dr. Stefanelli, French plastic surgeon with a double practice in Dubai and Paris. Today I'd like to present you my lovely patient, Rada from Russia. And Rada is 39 years old and we are going to perform on her a butt filler augmentation. As you can see, Miss Rada is a skinny patient. She's 172 centimeters for 55 kilograms and she has already a good shape, but regarding the butt, she aims to have a little enhancement. When it comes to the assessment of the buttock for any procedure, surgical or non-surgical, we need to assess the patient in a standing up position from the front, from the side and from the back. As you can see, we start the assessment of the buttock region from the front. Why? Because we want to assess the presence or no of hip dips. In this case, you see that there is no hip dip on the left, a little bit on the right, but actually this is not the concern at all of Rada. Then we ask the patient to turn 90 degrees and to lift the arm to appreciate the projection of the butt. She's okay with the projection, but actually her main concern is a lack of volume in this region. I like to divide the butt in three regions: the hips, the lateral butt and the medial butt. The medial butt will give definitely the projection and Rada is okay with that. She's really concerned by this depression which is in between the medial butt and the hip. So we are going to enhance this region, the lateral butt, with filler. And now we ask the patient to turn 180 degrees and we will see the vision from the back. You can see again here this lateral depression in the butt, a little level of hip dips, but again this is not our concern. And on the other side, again this lateral butt depression. I like to finish with some anatomical landmarks. First of all, the great trochanter at the level of the hip dips, then the ischial tuberosity at the level of the infragluteal fold, the posterior superior iliac crest at the level of the waist, and finally here the sacrum, and especially here the sacroiliac joint, which is forming the sacral dimples. And finally, I like to divide the butt in four quadrants: a vertical line passing by the midline of the butt and a horizontal line passing by the half of the intergluteal cleft. As you can see in Rada, she's really concerned by the lateral butt, lateral to this midline line, and not so much by the medial butt. So we are going again to perform a butt filler injection in this lateral butt area. And finally, it's very important to assess two elements. Number one, the thickness of the soft tissue. We do that with the pinch test, and you can see here we have a good 5 centimeter pinch test, which is ideal, and also the skin elasticity. And you see that when I'm stretching the skin, actually this is not sagging, not stretching too much, so this is also a very good indication for fillers. We are done with the assessment and now we are going to start the markings. I like to make three types of marking and I will use three types of marker. Number one, the anatomical landmarks in black. Then I will use the blue marker for the injection area, and finally the red marker for the entry point for the cannula. Let's start with the anatomical landmarks. First of all, I like to divide the butt with some lines. The first line is actually a horizontal line passing by half of the cleft, and we are going to mark this with some dotted points. It's particularly relevant when we inject the hip dips, but as I said before, in Rada we are not going to inject the hips, just the lateral butt. The second line is passing by the midline of the butt, and very often the midline of the infragluteal fold. So in this case, we can see that this line is here. And the last line that I like to show you a little bit from 3/4 is dividing the lateral butt from the hips. Here I can easily palpate my great trochanter. So I like to make a last vertical line passing by this trochanter. As you can see in this lateral butt, we have the upper, central and lower part. She has a good volume in the upper part and also in the lower part, but definitely she's missing volume in the central part. So I'm going now to divide this lateral butt in 3 zones, upper, central, lower, and we will focus our treatment in the central one. I'm now drawing the defect which is again the lateral central butt, not the medial butt, not the hips, not the upper butt, not the lower butt, definitely this region. Now I'm going to mark the entry point. I like to do for every zone 2 entry points. Why? Because I like to cross my threads of filler. In this particular case, I like to start with first entry point here, medial to the defect, and another one above the defect. This way I will be able to have 2 directions for my thread and to have, crisscross net, and finally this one I like to summarize. We are going to inject in this blue zone corresponding again to the lateral central butt HYAcorp MLF2 through these 2 entry points, medial and upper, using an 18 gauge cannula, and we will cross our thread. So we did the same markings on the other side, and as you can see, it's a little bit asymmetrical because the defect is not the same. You see here it's a little bit shorter, and on the side we extend a little bit in the hips because she has some degree of hip dips on the right. So I like you to appreciate the difference between the right side and the left side. Can you turn a little bit? You see here we didn't go in the hip dips, but it was a little bit higher in this zone, and on this one it's a little bit shorter, but we extend a little bit on the hip. So this defect is more, let's say, horizontal. The other one is a little bit more vertical. So now we are ready for the procedure. Let's go. Today we are going to use for our patient HYAcorp MLF2. HYAcorp is a body filler made of a long chain of hyaluronic acid. There are 2 types, MLF1 and MLF2. MLF2 has bigger particles, so it's more adapted for the hips and the butt. HYAcorp is made in Germany by Bioscience and has a CE mark, ensuring a very high quality and safety. What are the advantages of HYAcorp? Number 1, it's a non-surgical procedure, non-invasive, so the downtime is very short. Number 2, the safety. This product has been shown to be very safe, both in my practice but also in the numerous studies about it. Number 3, the efficacy and the satisfaction of patient. Again, very high. And finally, the immediate result. The patient is able to see the result just after the procedure, and they like that very much. So HYAcorp body is coming in 10 cc syringe, which has been shown to be the perfect volume. Why? Because 1 cc syringe, like for the face, is not enough for big volume like the butt, and 30 cc syringe will be too much. So really 10 cc is the ideal syringe volume. When I perform a HYAcorp injection, safety is my priority. To ensure the best result, I follow the ISAPS, International Society of Aesthetic Plastic Surgery protocol. First, patient selection. Who is being treated? We should be sure that the patient is above 18 years and is properly consulted and asked about their medication or allergies. Then, second point, who is doing the procedure? For this treatment, it is crucial that a physician or a specialist who is trained in this procedure, product and anatomy is going to carry out the treatment to minimize any risk of complication. Third point, where are we doing the procedure? This treatment must be carried out in an appropriate aseptic room with a proper lighting and all required tools. Complete sterile draping should be done. The cannulas and a HYAcorp syringe should be also prepared in a sterile environment by personnel dressed in scrub and wearing sterile gloves. Once all these safety guidelines are in place, we can move on the procedure. So we just move now to the treatment room, and I'd like to show you again the picture of my patient in different position, front, side, three-quarter and back. And as you can see, we are going to inject in the lateral butt depression, not so much in the medial butt nor in the hip dips, but definitely in this lateral butt between the hips and the medial butt. Now I like to show you the surgical table. We are in a very sterile environment. We have the sterile drape, sterile gauze, of course, the antiseptic. And now if we get closer to our tools, we have the syringe of anesthesia, which is xylocaine with adrenaline, and a 30 gauge needle. Then an 18 gauge needle for the entry point of the 18 gauge cannula that will serve to inject the HYAcorp MLF2 syringe. We plan for this patient 16 syringe, so it means each side will receive 8 syringes, so a total of 80 cc. So we are going to start the preparation of the patient. The first step is, of course, to do the disinfection. We are using chlorhexidine alcoholic in perfect condition. We do the second side. So now we are going to use this sterile drape with 2 holes, one for each butt. We are now ready to start the procedure. We start by the anesthesia of the entry point. Again with a 30 gauge needle, xylocaine adrenaline, this one too. Okay. Now needle 18 gauge. So this side is a little bit different than the first side. We have a less, let's say, vertical defect and a more horizontal defect. And we are going to use these 2 entry points, this one in particular for the most lateral part and this one for the medial part. But they will also do this crisscross network for stable results. So we start deep by pinching the butt. I'm on top of the muscle. Another one deep. stretching the skin a little bit like this. Okay, we are going now to change the entry point. Let's start the second entry port. You see that I'm going to reach now easily this part. This is more a little bit the hip dips. This is here the lateral butt. She has an asymmetrical defect. So first of all, this injection is deep. So now the tip of my cannula is here. It's very important to choose entry holes that are not too close where you inject, so always outside the injection zone, but also not too far. So this is 10 centimeters, and this cannula is also 10 centimeters, so this is the good length. Just in case you are a little bit short, you do this socket maneuver here. Okay, so we are 6 now. I will take another one, 7. Probably a little bit here. You have to take care of the transition zone. When you inject in a zone, then you have to make a smooth transition with the surroundings zone, not to be visible. And I like also to come back a little bit in my lateral butt to make some crisscross injection. Okay, I like to check patient in a standing up position. This is very important to always keep 1 or 2 syringes each side because we might have some bad surprise. The result might look good now, but when she will stand up, maybe there is a little bit defect here or here or here. Before to do that, let's massage a little bit. It's very easy to mold this product. It's not hard at all. There is a very good integration in the tissue. So we finish with this first side, and we are going to move to the second side. Okay, so at this stage we finish 7 and 7 syringe each side. So actually we didn't finish the procedure. Why? Because before to finish the number of syringe, I always like to check the patient in a standing up position. And we are able to see the irregularities or the, let's say, the remaining depression. So if we start on the left side, you are able maybe to see that we inject the product mainly here, and therefore here there is a little bit of product missing. So I'm going to mark it in a standing up position. This way after we can complete that. On the other side, it's a little bit more obvious. We definitely need some products here and even more anterior. We plan only to treat the lateral butt, but when we treat the lateral butt, it's very common that we need a little extra in the hip dips. We have this little depression. So you are able to see the markings of the additional injection we are going to do. And I like to mention that in this particular case, and this is really adaptation, I will choose an additional entry point to fill nicely this banana shape defect. And on the other side, we have more or less the same. Another entry point that will be here, and I will be able to reach this defect through these two entry points. So it's very important, you see, to check the result in a standing up position. And I'm going to go even further by doing the touch-up in standing up position. Of course, I need my nurse to come in and to help me to get the same sterile condition. I will have a special focus on the entry point, of course. I'm going to do the anesthesia. Can you turn a little bit? Of this new additional entry point. I will do the same on the other side. Turn, my dear. We will need less product, probably 1 or 2 syringes, not more. Okay, so we finish the treatment. I like to summarize everything. We did, first of all, on a laying down position, 7 syringes on each side, and then we asked the patient to stand up for the touch-up, and it was, I think, very useful. We injected another 3 syringes on the right and another 2 syringes on the left. Total 9 syringes, 90 cc on the left, and 10 syringes, total 100 cc on the right. I'll let you now appreciate a little bit the result. We inject mainly in the lateral butt, not so much in the medial butt, and not so much in the hip dips. So I like my patient to turn a little bit 3/4, and you are able to see now the result on this side, and even more when she's turning. Of course, we didn't inject the medial butt, so the projection is not so increased, but there is a more fullness and roundness in this lateral butt. Let's go on the other side. You see now on the 3/4 view the injection in the lateral butt and also in the hip dips, because there was a little bit of hip dip on the right side. Total 10 syringe. As you can see, it's absolutely possible to inject the patient also in a standing up position. And this is really a good way to avoid a bad surprise, after you finish the procedure in a laying down position and the patient say, oh, look at this, look at this, look at this, look at this. It will be disappointing. It will be a little bit too bad not to check before to complete the treatment. So thank you very much for your attention, and thank you to my lovely patient for her patience and braveness. Are the before and after care when performing HYAcorp. Before the procedure, I like to advise my patient to avoid alcohol, smoking, medication, and also hair removal treatment. Just after the treatment, this is very normal for the patient to experience some degree of tenderness, swelling, even bruising, but usually it resolves in a couple of days. However, to help the recovery of my patient, I like to give them some recommendation. Number 1, to apply some ice pack on the injection zone. Number 2, arnica, both topical and oral. Number 3, painkiller, but usually it's not very painful, maybe 1 or 2 days. Number 4, antibiotics. Even if we did the procedure in a very sterile environment, I want to avoid absolutely any type of infection and biofilm, so 1 week of antibiotics. Then, regarding the massage, just very gentle massage if they feel a bump, otherwise not too much to avoid any migration. And finally, to avoid intense activities, intense heat like long shower, sauna or hammam. During this procedure just done, I can really confirm that the application, the injection of HYAcorp is very smooth. The treatment duration was very short, half an hour approx. And finally, I can really assure you that the patient very happy, very satisfied, and so do I. Thank you very much.